I wouldn't say that this is a job, I wouldn't say this is coming to work, but it's really who I am, and it's a lifestyle that I do. Pediatric critical care is, for me, the most rewarding profession. So often we are at the most emotional, pivotal moment in a parent's lives, and we exhaust every resource we can in the intensive care unit, every single technology we can to come together and provide the best care we can for our sick patients who are often facing life and death. I think I was attracted most to pediatric medicine because it's a population that doesn't have a voice, and so they really need an advocate and they need someone there to be their voice in times of crisis. I think that as a children's hospital, you need to keep the patient in mind, but it's not only the child that's our patient, especially in the intensive care unit. Your patients extend to the family and the parents. And so you have to have a facility that's going to cater to the consumer, and your consumers are your patient and the families in this instance. Some of my research is in medical education and how can we foster our trainees and give them the best medical education we can and see if we can improve patient outcomes from that. And then I do a lot of research and innovation. And I think the future of Lurie Children's is all about connectivity, and it's about embracing the Chicago community, that creative hub that we are in the center of, and bringing that energy together to create really novel solutions for our patients. We're reaching out to other experts in other non-medical industries, and we're bringing them in so that they can help us solve our most critical problems facing our patients. We're also using predictive analytics and technology to better predict patient outcomes, so we can analyze the vital signs and we can analyze other patterns in the patient to predict an adverse event before it happens. There's a lot of research opportunities here that the Stanley Manny Children's Research Institute can certainly support. In the intensive care unit, I don't ever want to see these patients again. I hope that they never come back to the intensive care unit. But it surprises me every time that these kids don't want to leave when they're better because they actually like being in the hospital. And I think that that's a special thing that we do here.